Good evening. My name is Adebola Adebayo. Welcome to my reflection video on my capstone project. The title of my capstone project was an intervention for anxiety, depression of COVID patients that are put in isolation. Now, uh, what brought about this project was mainly because there's a study that was conducted by Yu et al. In 2020 that most patients who have been in isolation, could be due to COVID or other reasons, end up having anxieties, having depression, have loneliness, and sometimes it also leads to other health complications like heart problems or other mental related problems. So that's the reason why I decided to embark on this project, and it was an interesting project because I got very good feedback from them. Now, there are so many solutions that have been provided in terms of people that have done research in terms of how to take care of depression-related issues, patients who are in isolation. And so for my project, I decided to use education, being the fact that if patients are aware of the condition, their health situation, and the most likely the outcome of what they are expecting, they are likely going to respond better. They will be less anxious, and this is also based on a study that was conducted um, by a researcher in 2020 by Brooks, and he says that when you educate patients adequately enough ahead of their procedures or ahead of their situation, especially with the COVID. COVID was a very scary thing for a lot of people, and most people thought that probably COVID is like a death sentence to them. That once you have it, you're going to die. So with education, um, people or patients will be less anxious, they're going to be less depressed. So besides that, there are other activities that I also plan with my intervention to see how that, will change the outcome for the patient in terms of safety and quality. So I will talk briefly, specifically, I'm going to be talking briefly about, the feedback interview, the feedback from the patients, from some of the COVID patients on my intervention, how it worked, how they responded to it. I will also talk about the contribution of my intervention to the patient's quality of care and safety. I will talk about use of research or literature to design a capstone project and implementation of it. I will talk briefly about that. I will also discuss about the application of information technology to implement my intervention. I will also discuss about the policies, how policy of an organization or a government policy does have an effect on the intervention I proposed. So the number one thing, in terms of feedback, I got a very positive feedback from uh, my patients. Number one, the expectation of my capstone is that when patients are in isolation, they'll be depressed. And my expectation is also that if they're educated enough about the situation or their health conditions, they will also, be less anxious, they will be less depressive, and they still have more contact, things will improve. That expectation was met. Most of the patients were very, very responsive, and they were able to acknowledge that the intervention was effective, was, give them a hope, give them, made them to be less anxious about their problem, give them assurance, and they are kind of satisfied with the quality of care they got, at the end of the intervention. Having said that, now I'm going to talk briefly about the access. I'm going to talk about, I'm scrolling down, I'm going to talk about the contribution of the intervention to patient safety. Like I said, I've mentioned that already, that in terms of safety, even though the time of intervention that was implemented was a very short time, but it was effective. I got very positive feedback from patients that they felt better, they were less anxious, and they were not they were not depressed, and it's a very, very good one. And in terms of safety, that also helped them, because if they are not having mental issues, they were, they were more safe in the hospital. Now, how does this intervention reduce cost? How does this intervention reduce cost? Now, we know that when patients come to the hospital for, let's say, for COVID, and because of the COVID, because of the anxiety that is related to it, they became depressed. That led to heart-related problems. That led to complications. It's most likely these patients are going to come back again because of some other health complications. That will lead to extended stay in the hospital. That if there's an extended stay, then definitely it's going to lead to additional costs. It will cost the hospital more money. It also costs patients more money apart from the stress that it does. So this intervention in the long run will reduce hospital readmission. It will reduce other health complications that would have arisen because of depression or maybe because of anxiety that they're having. So it does in the long run reduce costs for the hospital and for patients. That's the response I got back from them. So now I'm going to move to the next topic, which is the use of evidence or the use of peer-reviewed journals to design the capstone. From my experience, literatures or previous researches is the foundation for every study. Like I said in the beginning, I came to know about this study because there has been a study that says that when you are in isolation, it leads to mental problems, it leads to heart-related problems. So that is from literature, and I have started that literature. Not only that, also from literature, it has also been shown that education, patient education, helps reduce anxiety, helps reduces tension. And so if patients are well informed, if they are not depressed, if they are not anxious, then they're going to receive better health, and hopefully they'll be able to go home early enough so that they don't also contact other health complications while in the hospital. So I would say peer-reviewed journals is the foundation and is the guiding, is the direction. It was very, very helpful to see that people have done it, so it makes the job easier to be able to pattern a study along what other people have done in the past. Next topic is number 4 is the use of healthcare technology and the use of technology to improve or to be able to implement my intervention. Yes, I was able to use technology. It was a COVID time. People are kind of very skeptical of meeting with someone face-to-face, health-related issues, infections, and so because of that, most of my interaction with the clients or with the patients is through virtual, through telephone phone calls, through making phone calls and talking to them, either through Facebook or by making phone calls. So, but besides that, the other technology that I made use in my intervention was the use of the social media, because everybody does have cell phones, everybody have access to the social media. They have access to questionnaires that can talk to them using that interface, and it is kind of user-friendly interface. So technology goes a long way to make the capstone very effective and to be able to reach out, to the patient, even remotely. So technology is key. Next, I will be talking about the influence of policy. When I was working on the intervention, it was critical that organizations, especially the place where where I work at the hospital, they have their own policy in terms of what you can discuss with the patient. Policies on the use of the social media, policies on the use of cell phones, because of HIPAA regulations, because of privacy issues. So and those were the challenges that I had, going into this intervention, developing it. But the good thing is that most hospital organizations are in support of the idea that they want patients to be safe. They want them to leave the hospital early enough. They don't want unnecessary complications due to their stay in the hospital. So, and then the U.S. government also had a policy that they relaxed the use of policies and restrictions on the use of social media at the hospital because of the COVID time. So it made it possible to be able to communicate, interact with them, and not get into trouble with the issue of violation of HIPAA regulation. So yes, it was challenging to be able to break that, but with the U.S. government policy regulation reducing that during the COVID pandemic, that made it easier to be able to use social media and cell phones to be able to interact with patients. The next topic I will talk about, so after talking about the policy, about HIPAA policy, now the next question I want to reflect on is whether the capstone outcome matches with my initial prediction. I would say yes, the capstone prediction matches with, the capstone outcome matches with my prediction. My prediction, and based on other studies, is that yes, patients, when they are isolated, they get depressed, they become anxious. And other studies that have shown that if you educate them enough about their situation, they will be able to respond appropriately. There will be less depression, there will be less anxiety. And that exactly was the outcome of my capstone study. That was achieved. The next is to discuss about my personal experience with the BSM program of Capella University and my capstone project on my own professional development. Yes, I have learned a lot during this program. During the program, I've learned specifically how to do a lot of managerial skills in terms of how to handle staffing, how to deal with the issue of safety in the hospital, how to be able to set up what I call the mark stones or the target in terms of how do you measure, take for instance, if issue of falls in the hospital, what are the standards? How do you establish those criteria to be able to say that your hospital is safe for patients? I learned that. I learned about root cause analysis, how, it was one of the things that I really, enjoyed learning through this program. Root cause analysis, identifying, incidences, how to build up to solve the problem, how to find out what really caused it. And it was interesting to find out that most of the health-related problems in terms of fall or in terms of medication error, sometimes a lot of them has to do with human error, or some of them also has to do with the system failure. So I learned that at this program. I also learned how to make presentation videos. I learned how to use PowerPoint presentations and be able to do videos and be able to do a presentation with my own audio voice in it. I've learned how to write, scientific papers, and it has really helped my professional career. I've learned how to be able to interact with patients more. I've learned how to deal with management more effectively based on the things that I learned at this program, at the BSM program. Very, very, very good program. And very soon I'm hoping I'm applying for management positions now, and I'm hoping that with the knowledge I have here, I will be able to get those positions. With that, I have come to the end of my presentation. The references I used during this capstone and for this presentation is a reference from CDC, from the Center for Disease Control and Prevention. That was a survey on mental health, of household mental health during the COVID. It was done in 2020. And another reference was UB et al. 2020 about social isolation, loneliness, and the mental problems that comes with isolation. That is published in the Psychosomatic Medicine. That was published in 2020 also. Lastly, I also used a reference from Brooks et al. With other publishers that is published in 2020. The title is The Psychological Impact of Quarantine and How to Reduce Rapid Review of the Evidence. That is the last reference. There are other references that I've included in my publication. I would like to say in conclusion that the capstone was done